Hi mommies, my name is Buhle Khumalo. I'm an independent midwife at Mommy Bear Women and Baby Clinic. So today I'll be telling you about the breast changes that you go through during your pregnancy. Yes, you heard that right. Not only your belly grows, but there's changes that happens to your breast as well. As you see, I've got my props here to illustrate that we are all different as women. So our breasts are not going to be the same during pregnancy. Someone's breast might grow and become really big, others will just grow a little bit. But on average, women's breasts can actually grow from carrying 12 milliliters of milk to, by the time she gives birth, it's about 227 mils of milk that you can carry in your breast, right? So the changes that we can go through, you're looking at size. So from the onset of your pregnancy, your breast might start to get bigger. Tenderness, almost like when you're having your period. The breasts are going to feel very tender and very full when you're touching them. Also, you might see visible veins on your breast as well. These are all changes that are due to hormonal changes. When you're looking at the breast itself, your nipple might start getting a bit bigger and dark. Your areola also gets darker and gets bigger. The reason for this is so that baby is able to latch and see the areola after birth as well. Stretch marks are common. The reason for the stretch marks is because your breast is growing. Like I said, it's increasing in size, so your skin also stretches. That's the reason that you get the stretch marks on your breast. They irritate you. There are creams in the market that you can use to keep the stretch marks at bay. Towards the end of your pregnancy, when you're pressing your breast, you might see there's a bit of leakage that comes out. It might be clear. Sometimes it might be a bit whitish or yellowish. That is colostrum, and us midwives like to refer to it as liquid gold, right? So just to recap quickly, first thing that goes up, it's the size. Your bra size goes up. It is important that throughout your pregnancy you wear comfortable bras and the perfect bra size for you. Some women prefer wearing nursing bras or sports bras because from first trimester to third trimester, your breast might grow to breast sizes, so bra sizes. So you might find that the bra that you got in your first trimester will not fit by the time you get to the third trimester. Right? The reason also for the growing of your breast is due to two hormones, the estrogen and the progesterone. That's what helps with the growing of your hormones, right? The visible veins, you get them more visible. They can be blue or a bit purple. The reason for that, it's the increase of the blood flow that goes to your breasts. So everything in your body, your heart pumps more, there's increase in your hands, you might feel a bit more blood. So also the same thing happens to your breast because they are part of you. So there's going to be an increase in the blood flow and then they become visible, the veins. You are not ill, it's normal. The changes of the areola and the nipple we spoke about. Some women have inverted or flat nipples. That is normal. Speak to a healthcare provider. They can assist you and prep you and help you so that when baby is here, you're able to latch baby onto the breast as well. We're also looking at, we spoke about stretch marks that happen, colostrum, that's normal, especially towards the end of your pregnancy. We all spoke about all the normal things, but now, when do I know that I need to seek help? Something is not normal. So when you're pressing your breast and you're checking your breast and you feel a lump, any lump that you feel in your breast, or your partner might feel it for you, which is most common, then please go to a healthcare provider and tell them there's a lump that I'm feeling in my breast and have that checked out, but don't just sit with the lump in your breast. Any bleeding from your nipple. So remember I said there might be leakage of colostrum towards the end of your pregnancy, but during pregnancy now there's bleeding from my nipples. That is not normal. It's a red flag and you need to let your healthcare provider know. So those are all the changes that are common and uncommon. Enjoy your breasts whether you want to breastfeed or you don't want to breastfeed. For the fact that you're carrying a baby, your body will prepare meaning your breast will prepare for breastfeeding baby should you want to. Should you not want to, then everything will go back to normal. And if you breastfeed, enjoy breastfeeding. If you're having issues with breastfeeding, speak to your healthcare provider, speak to your midwife, speak to your lactation consultant, speak to your doula. Those are the people that can actually help and support you. You can breastfeed as early as baby is out. So that first hour, you can help baby latch on the breast. So we spoke about the aleora and the nipple. So that helps with baby. Meet my baby. So it helps with baby with latching. So when baby latches, baby opens the mouth really wide and the whole breast goes in. So when baby is breastfeeding, baby doesn't breastfeed from the nipple, but this whole aleora most of it needs to go into baby's breast. So that's how you know baby has a correct latch. But like I said, any issues with breastfeeding, please speak to your healthcare providers. Happy breastfeeding, mommies, and take care of your breast. Thank you.